What are some useless tests you said these IVF doctors?
Okay, so you break it up into men and women. Both are fertile for exploiting. So men ke liye, the only useful test for us, see, whenever a man does a test, what's the question he's asking? Can I get my wife pregnant with my sperm? That's the only thing he wants. You can't answer that question. Let me tell you right now. All you can do is a semen analysis, which means you can do the sperm count. But a sperm count is not like a bank account. Ultimately, fertility depends on the fertility of the husband and the wife. Now, there are people whose sperm count is only 2 million, which is very low. Normal is 15 million, whose wife is very fertile, who have 2 babies in the bedroom. But they have enough sense not to go to a doctor and get their sperm test done. So who are the guys who go to a doctor? Only someone who thinks they have a problem. So doctor ka bhi bias hone lagta hai, and some doctors think they're the smartest. And it's all no longer evidence-based medicine, it is eminence-based medicine. In my 30 years of experience, whatever. So this didn't work. So now you'll do a lot of more tests because semen analysis is not good enough. So we'll do sperm DNA fragmentation, we'll do a chromosome study, we'll do a microdeletion, we'll do a teaser. All this stuff is on my website, incidentally, if you want to go into the gory details of all the useless tests.
But all of these are not needed, you're saying?
At all.
Oh.
See, which is I always tell patients, you only need to ask a doctor one question when he tells you to do a test. This is true whether you're a cardiologist or a neurologist or an IVF. How will this test change my treatment options? If it is not going to change my treatment options, please don't use me as a guinea pig and don't make me waste my money because all these are very expensive tests. And then what happens, you do a test, it's abnormal, dekh ye problem hai, abhi tu ye goli kha, fir se test kar, dekh ye problem hai, not related, abhi ye problem aaya, abhi tujhko IVF karna padega. Just creating work for themselves, let me tell you that. So anyway, there's a long list. That's just giving you one example. These are called advanced sperm function tests. And sperm DNA fragmentation is a great example of it. Doesn't correlate with fertility, but patients to sab gade hai. Gynecologists bhi sab gade hai. Unko to kuch samajhta nahi hai. Laboratory mein report aaya, itna DNA fragmentation normal hai, itna abnormal hai, tera abnormal hai, tu ye goli kha, ye surgery, anyway. So that's one set. For women, it's much more. Because obviously, women are far more complicated. So the tests start from even before you actually start your IVF cycle to during the IVF cycle. But it's worst after the IVF cycle fails because that's when they're most vulnerable. Oh, your IVF cycle failed. Now we need to test your chromosomes. Your IVF cycle failed. We need to test your endometrium or your uterine lining for what is called an endometrial receptivity assay. Your IVF cycle failed means your embryo didn't implant. So we need to do an embryo biopsy called a Preimplantation Genetic Test of your embryo to find out whether your embryo is genetically abnormal or not. Long list. I think it has 33 things. It's on that Eshrey paper. It's called a list of add-on tests and which are useless. There are lots more, but I don't want to get into the technical details.
But can you help us understand what would be the approximate cost of all these tests one by one? Because I want to understand how much money people are spending.
It's unlimited.
But
because the more the tests you do, the more the money. Then you can repeat the test.
But what would be the range? What is the cost of doing these tests?
I think in ERA, I don't do any of these tests. Okay. I'm not even the right person. But I think an endometrial receptivity assay costs 30,000-40,000 rupees. Okay. Again, like I said, useless. An embryo biopsy costs 30,000-40,000. And these are all add-ons. So your basic IVF cycle, let's say, is 2 lakhs, whatever. Your injections cost 1 lakh. This is just your baseline. And you just keep on adding. And then people will say, in for a penny, in for a pound. Itna sara paisa kharch kar rahe hai. Doctor bol raha hai, next cycle se chance badhana hai, to ye karo. To theek hai, ye bhi karenge. And then, because you paid for 2 cycles and the first cycle failed, you're stuck. It's a sunk cost. You already paid for the second cycle. Then the doctor will say, first time के injections थोड़े इतने अच्छे नहीं थे, वो package के थे, हम और अच्छे quality के injection देंगे, लेकिन उसके लिए आप 50,000 खर्च करना पड़ेगा. It breaks my heart. So, when I tell patients, मेरा blood pressure बढ़ता है, please don't tell me all this.